It's 6 p.m. Central and we're going to get started. Thank you for joining the AAN Applying to Child Neurology Residency in 2021 webinar. All participants are muted. If you have any technical difficulties, we recommend disconnecting from the webinar and reconnecting. Connect using computer audio or by the dial-in option. You do not need to use both. If you continue to have technical difficulties, send a message through the chat feature and we will try to assist you. For questions to the panelists, please use the Q&A feature, not the chat, and we will answer them throughout. I'm pleased to introduce our panel members for today. Our moderator is Dr. Audrey Foster-Barber, Program Director at UCSF. Our panelists are Dr. Aaron Nelson, Program Director at NYU, Dr. Sudha Kessler, Program Director at Children's Hospital of Philadelphia, Dr. Gary Sheesh, Program Director, Cleveland Clinic, Dr. Jamika Hallman-Cooper, Program Director at Emory University, Dr. Peter Sarnacki, Senior, Resident at Cleveland Clinic, Dr. Adriana Morel, Resident at UCSF, Dr. Hilary Eichelberger, Resident at NYU, Dr. Gabrielle Subar, Resident at Emory University, and Dr. Brian LeGrant, Resident at Children's Hospital of Philadelphia. Dr. Foster-Barber, I'll turn it over to you.
Thank you. Welcome, everybody. We're excited to have you here to talk about the second season of virtual interviews for our specialty, pediatric neurology. I want to thank the AAN for organizing this and advertising it on Twitter and elsewhere. We're excited to have you here. Welcome if you are definitely applying, maybe applying in a few years, or applying in adult neurology. I think we are collaborators and are happy to share information. I also want to thank the panelists, the program directors and the residents for joining. We have a really great assortment of amazing program directors and really sort of picked from around the country and different types of programs. So I think this will be helpful information for everybody. This is designed to be agnostic to the program. This is designed to give advice to you no matter where you are applying. We will give you our advice both from our own experience and from our collaboration in the field. So no advertising, just good information for you no matter where you're thinking about applying. We've had a lot of good questions that were given already, and you're welcome to use a Q&A for additional questions and direct them even to particular people if you'd like. I'm going to start us off with one of the most common questions, which is just this virtual interview process. This is our second year, and a lot of lessons were learned last year. And a lot of questions remain. I thought I might actually start with Dr. Nelson to talk a little bit about Zoom. We're all getting used to it, but just thought processes about how to make the most of your experience in Zoom interviews, and then we can move on to other questions from there.
Thank you. So most of you are more familiar with the technology now than you were a year or two ago, but you still want to practice and you want to be prepared. You're going to get a lot of different emails and contact information from different programs, and they're going to each approach things differently. And so you can do Zoom interviews, you can do WebEx, people may be using other platforms as well. Regardless, you'll have gotten an itinerary, you'll have gotten either one link or a set of links that will go to individual faculty, or they may keep you in one room while the faculty come and go. Regardless, you want to have looked over it in advance so that you're not trying to figure it out in the moment, and you want to have tested your technology. Most people are going to be comfortable with a computer or a laptop in a quiet environment with the microphone and with the camera. If you need it, you should go ahead and use headphones. No one will judge you, no one will give you a hard time for that. That's very normal. However, you want to have backups. It's very common for people to suddenly have a technical issue, to have a computer go out, not work, whether it's a battery issue, whether it's power, whether it's Wi-Fi. My advice for most people is to have a smartphone loaded up with the appropriate software as a backup where you can access the link directly. And so if you suddenly drop out, you can be jumping on within honestly 5 to 15 seconds notice. And then I would go through that. And once you've done a couple of interviews, you'll very quickly find an old hat, and then it won't be scary or confusing anymore. But particularly for the first ones, you can do a dry run, or you can work with friends or family to practice doing it over a virtual setting if you haven't already.
Awesome, thank you. Yeah, I think that's the scariest thing on the day of, what might go wrong. And believe us, we are all as worried and have backup plans as well, because we really want to show our programs well to you, but also know that we recognize we're all human, and there will be glitches, and those aren't going to impact how we look at you as an applicant. It'll just be a little stressful for us all, but we'll work through that. I think one of the nice things this year is it's not the first year this is happening. And so we have a little bit of data about how last year went. And you can see some of this in the AAN guidelines for this year's interview season, which we can share in the chat. But basically, last year went really well. Our match rate was the same as other years. I think our biggest worry was really how you as trainees get to know programs and choose where to go. But in terms of success of matching to a place, things went really well. You'll see in this guideline, if you want to look it up, the kind of number of programs that someone had to rank to make sure globally that all of the people got where they wanted to be and had a match somewhere. And for US medical grads, at least no one went unmatched if they ranked at least 14 programs. So not a crazy number. We don't need people applying to 50 and 100 programs and ranking that many. A fairly reasonable number. And obviously some people ranked fewer and some people ranked more, but just to give you a perspective on that. I wanted to maybe turn to one of our other program directors to talk a little bit about the process, and in particular for your program or for all of the programs. Did you think about interviewing more people or doing things differently to showcase your program? I wonder, Dr. Hallman Cooper, if I could ask you to answer that first.
Sure. We did, in terms of it being the first year last year and not quite knowing what to expect. We did increase the number of applicants that we interviewed. We interviewed for 3 categorical slots. And so typically we would do 8 to 10 applicants per slot, but last year we did 13 to 14 per slot.
And any other program director want to add to that comment? Okay. Yeah, so I think one of the things that we noticed is there were fewer cancellations for the later winter interviews because no one was stuck worried about traveling, and so the wait list was less likely to be dipped into, but I think we all interviewed slightly more applicants, and I suspect it will be similar this year as well. I wonder if I can turn to Dr. Kessler to maybe comment about how programs focused on how to showcase themselves in the virtual environment. What kind of things programs do to let applicants know about their program?
Sure. So from our own experience and speaking with other program directors that were interviewing this way last year, it was, there were some variations, but common themes were that we wanted to preserve the experience of applicants getting to speak to residents, to spend some time with residents without the program director or other members of the interview committee around. I think that the way that happened probably varied, but I think many programs transitioned from having an in-person dinner to having some sort of evening event where applicants could have a Zoom session with current residents of different years to ask them questions about what the experience is like. And I think that was useful not just for getting to know individual programs, but probably for getting a sense or a feel for the field in general and what their experiences were like when they interviewed. Other things that people that I know that people were using were, well, for example, we had a website that's not public facing, but was password protected, and basically a brochure and a website form that applicants were given when they were invited to interview, that had a lot of detailed information and pictures of our setup and our families and all of that you wouldn't necessarily want to make public, but that we wanted everybody to get a feel for. And then I think that the other thing that varied between interviews, sort of but an open question for all of us as program directors as well, is how many interviews might you have in an interview day, especially if you have pediatrics on one day, which is a set of interviews, and then child neurology on another day, which is another set. I know we adjusted to the number downwards so that people wouldn't have the same, wouldn't have Zoom fatigue from sitting in front of the screen and speaking all day. So I think those were some of the highlights that I can think of.
Yeah, I think that every program put together some sort of social event, and many put together videos, so you guys can all see how badly neurologists do on TikTok, for example. But I would say for all of that information, you'll do your homework about the place you're going to interview. You'll look at the public website and understand who the faculty are. There's no quiz about all of the other supplemental information. And I've had some applicants tell me they actually looked at it after the fact when they were kind of thinking about the rank list, as opposed to feeling like they had to digest massive amounts of information before the interviews. They just wanted enough to be able to ask questions about a program. I thought I might ask Dr. Sheesh to comment next about another aspect of interviews, which is something we've talked a lot about: second look, anything in person. There's been a lot of talk within the field about that. I wondered if you could comment for us.
Sure, definitely. Yes, some people might want a second look because, or to actually visit because they want to look at the geography and look at the environment in the community. It's definitely not something that's expected or required. So if people cannot do it, or applicants cannot do it, I mean, we certainly understand, and especially with how the pandemic is going and the costs and things. But yeah, if you're interested and trying to decide between a couple of different programs, you want to get a better feel of the community of the hospital. Some programs have set up a system to enable that, but definitely shouldn't feel that it's mandatory or that you're not showing enough interest with that. That we all, as program directors, certainly understand that applicants can't always travel to every single program that they like, and also it's not necessary, and we certainly wouldn't be able to probably handle every applicant that wants to travel and see us too. So yeah.
Yeah, I think a lot of hospitals still have visitor limitations, so it probably wouldn't be something where you would come and go on rounds or see the hospital. So I guess the yield of it is a little questionable, but most of us, and the recommendation by the AAN and actually by the NRMP as well, is to, if it happens, to set it up in a way that it's separate from what the interview and selection committee is aware of. So it really, is informational for an applicant without impacting the committee. So let's move a little bit to some of the specific questions about the application itself. I know if you've seen the guidelines from AAN, we all are really emphasizing the holistic application review process, specifically not having a single number or a single type of thing that is the cutoff for inviting applicants for interviews. Common questions that come up. Maybe I think I'll start with Dr. Hallman Cooper to talk a little bit about board scores. Is there a minimum? What if there are other red flags in your transcript? How do you address those things?
Sure, I can address that. So in terms of board score minimums, I think that varies from program to program. What we do know about board scores, when we look at board scores compared to how you perform as a clinician, they don't correlate very well. So many programs have went to looking at other factors beyond board scores as to decide who they're interviewing or not, as Dr. Foster Barber mentioned, looking at you more holistically. Definitely, if there are red flags in your application, such as repeated attempts on the boards, or there's gaps in your training, you want to address that in your application. And my suggestion is addressing it in your personal statement. You don't have to spend a lot of time on it. You want to be kind of very clear and honest about the situation. Try to stay away from putting too many the emotions surrounding it in it. Talk about what happened, what you learned from it, and what steps you put in place to avoid that certain pitfall for the next time. So in terms of that, and then also if you've had some gaps in training, or there's been some time from when you graduated medical school and started residency, just talking about what you've done during that time, how you stay connected to clinical medicine. Also, it's important when you're getting your letter writers, make sure you're picking people who can actually really commit to giving you a strong letter and who know you well. You want to have an honest discussion with those letter writers as well as to what some of your red flags may be, so that they can also address it in their letter, hoping that helps us to assure us that, despite this, we've seen this applicant perform in this way, and we know that they will still be successful in residency despite this particular red flag.
Yeah, that's great. Thank you. I thought because this has come up in the chat and was also a sent in question, I would have Dr. Sheesh talk a little bit about DO students and how are they perceived within the child neurology field, and do you need both the COMLEX scores and the USMLE?
Right. Yeah. Thank you. Yeah. So with the DO students, you guys are definitely high quality students. We've had a lot of applicants, residents. A lot of us has worked with physicians who are DO students. So we evaluate them in the same way, holistically, personal statement, letters of recommendations. The test scores, we do use, a lot of people use them to try to compare or standardize some kind of evaluation. And so whether it's COMLEX or USMLE, I think most programs do not feel it necessary that applicants have both a COMLEX and USMLE. I think one set of scores is probably good enough. If you have both and one of the scores is outstanding, that might add some additional information to your application. We're still looking at things like activities and volunteer work and research. I think it's very interesting. As I talked with DO students over time, they're training and they have this kind of very holistic evaluation of patients that I think is very meaningful for especially a lot of what we do in pediatric neurology. If you're looking at these very top tier academic research universities that take a lot of MD PhDs, that have a lot of lab basic science research, those are competitive even for MDs. And so I think those can be, I think, competitive and difficult for everybody. So the DO students, I definitely encourage you to, apply to a lot of places, and please don't be restricted or feel inadequate or self-conscious about where you apply and what you're and where you go. You might be very well surprised. Regarding international medical graduates, it is tougher to evaluate international medical graduates. It's hard for program directors to know about every single medical school out there. There are some medical schools that we do know about because we've had other experience. We've had other students, applicants, and faculty from some medical schools, but there are going to be other medical schools we don't know much about. And sometimes the best that, we look at the letters of recommendations. We do, sometimes there can be a different emphasis, potentially, possibly some greater emphasis on those test scores. And you know, sometimes if students are able, we do look at their rotations if they've been able to do, because one of the toughest things is there is a lot of variability in medical schools. There are definitely fantastic international medical schools out there, but sometimes the quality of other medical schools can be quite variable. And so one of the things that we're looking at is, what is their clinical experience going to be like? It probably does help if international medical graduates are able to have some kind of clinical experience in the US, and more than observerships. Observerships are really tough for us to evaluate, because technically you can't, in an observership, really speak with patients, do a history and physical, and do the sub-Is and the acting internships that in the same way. And so I would encourage international medical graduates, if they can, to actually try to do a sub-I or an acting internship rather than an observership if possible. But I know that that can be very difficult because what we really want to see is that they can function in the US medical system, and that they have some of the good, the same level of training that we see with our other rotators. Some for the international medical graduates, they sometimes also feel strongly that they need to do research, and you know, I'd be interested in what the other program directors think about this. I think there's a kind of a plus minus about that. It's always interesting to see research, but it's certainly not mandatory and not absolutely required. And also the research can be quite different from people's clinical experience. You know, so people can be very, very good researchers, but their clinical skills can be different. And likewise, people can have excellent clinical skills, but not necessarily be great researchers. The other thing about that is that when we're evaluating applicants, we do, in some sense, look at how recently they graduated, because there is some concern is if they graduated too long ago and they haven't been involved clinically or had a lot of clinical experience in the most recent past few years, that some of their clinical skills may have deteriorated a little bit. And if they've been doing a research job for a few years, that could be an issue. And sometimes that is a concern that our PEDS group has also brought up, because sometimes when we are evaluating people and looking at who to interview, there is a kind of a combined judgment. You know, we look at a list of people that we like, but in our program, we forward that list to our general PEDS group for them to approve that also. So there are some things that we both have to mutually agree upon. And so these are some of the issues that have come up.
Thank you.
Yeah.
Yeah, thank you. Actually, Dr. Nelson, I was just about to call on you as well to comment on this, and then I may have another question for you, but go ahead.
I just wanted to add, because Dr. Shi touched on a really important point that I think should be emphasized, is that the pediatric programs and the child neurology programs talk and work quite closely together. And so I would bear that in mind, not only as it applies for international medicine graduates, but just across the board. Even though it is one application, if you're applying to a categorical residency, just bear in mind, we are meeting, we are talking. It goes a lot beyond even just sort of a few messages passed back and forth, because we really want someone who will mesh well and work well across the entire 5 years of training. And so bear that in mind, both when you're evaluating the pediatric residency, but also understand that they will be giving us feedback on their experiences with their interview days as well. And it carries a lot of weight.
Thank you. Yeah, that was sort of one of the questions I was going to ask you is, you know, that's one of the unique things for our training is you do 2 whole years of pediatrics. So thank you for addressing that. So Dr. Kessler, maybe I can turn to you. I'm going to kind of combine 2 questions that I think are related. One is, you know, is there a ideal child neurology applicant? Is there a type? And then combined with that is, this dreaded personal statement? Should it be jazzy and interesting? Should it be boring? How do you relay what you need to in that?
Right. Excellent questions. For the first question, I say no, there's not one person. I really, truly don't have any sort of preconceived notions about what I'm looking for. We read every application that we get, and top to bottom, and we don't have cutoffs really in any of the categories, whether it's scores or grades. All of those things matter, and for us, dean's letters matter quite a bit. The comments that you get in rotations, recommendations matter as well, but recognizing that many recommendations will be very enthusiastic, and sometimes we have to sort of it's very helpful for letters of recommendation to include really specific comments, including maybe even an anecdote about that person's experience with you. That tells us so much, which gets to what should you put in your personal statement. So the whole point of an application is so that we can get to know you in some way, both getting to know you as far as your skill set and how you learned, how you performed in medical school, but also just getting to know you as a person. You know, we are going to be investing 5 years in you, and hope that you invest 5 years in us. And so there is a lot of consideration of who you are. And so in the personal statement, I know that students get lots of different advice, and you should listen to all of that advice and decide on your own what you want. But I know that when I read a personal statement, the things that stand out are things that tell me about you as a person, whether that's something about where you grew up or experiences that you had that led to your choice of child neurology, whether that was early in life or even in medical school, just something personal about you. I think one common mistake, or at least I think of it as a mistake that applicants make, is spending a long time talking about a patient that they saw, because ultimately for us, those stories aren't as meaningful as a story about you, because we see a lot of patients, and I know that many of you might have sort of an index case in your head that really influenced you. And if that's so, then spend more time talking about what that experience meant to you than talking about the clinical case itself. And also just realize, be careful when you're making big sweeping statements about the field, like, child neurology is a field that, because the people that are interviewing you and reading your personal statement have been doing child neurology for a while. And so, just remember who your audience is. And then please get other people to read it, not just for the grammar and technical errors, but just read it with an eye towards, does this sound like me? Does this feel like who you are? And I think that can be a good path to putting something on a page that is meaningful.
Thank you. Maybe before we pick a specific person again, any of the other program directors have specific do's or don'ts or advice for the personal statement, which feels so important, or for asking people for letters and helping them to write a good letter for you?
I would just add, in your personal statement, as Dr. Kessler said, we want to learn more about you. So please don't spend a lot of time rehashing what's already in your CV and what's in your application. We want to take time to learn more about your background and what brought you to child neurology, and the type of person that you are. And then in terms of letter writers, definitely, again, as Dr. Kessler said, I can't reiterate more that you need to find letter writers who truly do know you and can talk about you personally. Like, we don't enjoy reading letters that rehash your credentials and your CV and everything else. We want to know what was a specific example of something that you did that impressed that person who's writing a letter with you. Or again, if there was a red flag, how has that person seen growth in you from that? So making sure that the person that you pick is able to do those things.
Thank you. Yes, Dr. Kessler.
If you rotated with an attending and were part of a team that included residents, one thing to think about is to, when you ask that attending physician for a letter, would be to see whether they would be comfortable adding some comments from the residents you worked with as well, because you might have actually spent a lot more time with the residents on the team than the attending, and I think that can be really meaningful as well, to add some specific comments from near peers to your letters.
And then something came up in the Q&A that I thought I might ask Dr. Nelson if he wants to address a little bit, and others can comment. Geography. So for applicants applying to places they haven't been before, how important is it to express interest in the place, or how important is it to the interview committee to understand any connection or lack thereof to that location?
I think it is important. I think it's very important. As someone who was born in Iowa, grew up in the Midwest, and was in med school in Minnesota, I then chose to come to New York. And my wife was also in medical school in Minnesota and was the first one trying to move to New York. And she had a lot of difficulty convincing programs that she was serious about this. And so it can be difficult. You'll get told a variety of things across the spectrum about doing visiting electives. I'm a big proponent of them, but they have to be used sparingly because there's only so much you can do. And visiting electives are really sort of a two-way street sort of interview experience at one place. But I think it's very important to explain the why. Getting back to the statements people have made about the personal statements, we really want to understand people's thought processes. And I can take someone very seriously who wants to come to New York, who has very little experience with New York, if they can talk in a way that shows they clearly understand the pros and cons, because every place has pros and cons, and they understand what the differences or challenges might be for them and how they've already thought about how they want to overcome them. I think that it is very important, so that, especially in the age of virtual interviews, because the one big thing I noticed that was different, and other people should jump in and weigh in about this, is that this year we had a lot more applications from all over. And it was a lot harder necessarily to tell which applicants had really thought about your location or what it was going to be like to live and train for 5 years, which is a really long time. So I'd encourage other people to weigh in, because they may have other thoughts on that.
Yeah, I think one comment I would add to that is that, being in one of the far coasts, we definitely saw people from all over the country, from locations we hadn't seen before. And that was a question. It's easier to do a virtual interview, but what does that mean about likelihood of coming? I think one of the benefits of the match is that we don't have to, and we can't ask someone to, tell us, but a helpful thing for me was actually the connection that applicants made with residents. In the social events, the residents get to meet you all, and while they're generally not on a selection committee, they certainly communicate with the committee about how great it was to meet people, or hey, did you know that this person, like, they've asked me about neighborhoods, and they love hiking, you didn't realize how close X, Y, and Z was to hiking. And so we do get feedback from the residents about someone that seems to be kind of taking a little deeper dive into maybe moving to a new place in the country that they hadn't been, and that's helpful. I'd be curious from others on the panel, do you think people should be writing individualized personal statements for different programs, or talking about why they want to be at a location, or is that something that can come up during the day of the interview? How do you think that should work? I saw Dr. Kessler about to say something, or Dr.
I think that I think it's okay to have that come up during the interview day. And it doesn't need to come up in every interview day, because of course, typically people on a selection panel will be telling all the other people on the selection panel what their conversations were about, and adding different pieces of information, things that we learn about you to our collective knowledge. And I think that it would be highly burdensome for you to try to write individualized application, personal statements for every program. And I would encourage you to write the best single personal statement that you can, and one that really just tells us about you.
Dr. Hallman Cooper, you were going to say something as well. Thank you.
No, I don't have much to add to that. What Dr. Kessler said is definitely what I agree with.
I'm going to turn to Dr. Sheesh for just some comments on the dates. So how important is this September 1 opening of ERAS and the September 29 date when programs can start to look at applications? Do you need your application in at a particular time? Maybe you can make a few comments on our process.
Right, yeah. So, I think the important date from the program director's perspective is September 29th date, because that's when we can first start seeing the application. So if the scores are in there, the letters of recommendation, so we can start evaluating them, because we're trying to evaluate them as soon as we can and then offer out interviews. And so if there are parts of applications, like especially scores that are missing, or maybe some letter recommendations that are missing, then we move that application into a kind of incomplete pile and we can't fully evaluate it yet. And then we might offer up all these interviews, and then the interview spots may get taken. And so I would definitely encourage applicants to try to get their paperwork in as soon as they can. It doesn't have to be in right away at September 1st, but certainly by September 29th, when program directors can start looking at them. I think that's an important date. Yeah.
Yeah, I think we all put that on our calendar and start, racing each other to invite applicants. I know there's some concern with, the steps of the boards being, delayed, and I think we're all definitely going to be understanding of that again this year. But the personal statement, the letters of recommendation, your transcript, and whatever board scores you have from previous definitely should all be in there by that date. Anybody else have a comment on that part?
I just wanted to add that please don't get discouraged if you don't get an onslaught of invitations on September 30th, because it does take time for us to review applications, and we like to wait to have dean's letters, and so please don't lose heart. Just trust the process that you will get interviews.
And is it a first come, first serve? If you get your application done earlier, are you more likely to get an interview, or how is that working for most programs? Dr. Nelson.
So to echo what Dr. Sheesh said, not for the first date. We don't do it first come, first served during that time window from September 1st to September 29th. Honestly, I don't care. I don't look at it. If you miss that initial window when things open up, the question for me as a program director is why? And there's going to be legitimate reasons that are beyond your control. And if that's true, you may even at some point want to address it. But the reality is, otherwise, if you've missed that date for something that you were personally responsible for, my question is going to be why. And all things being equal, we have stellar applicants across the board. You want someone who is organized, who is on time, who is able to do these sorts of things. And while each individual might have a very legitimate reason, if you take all comers, it's a red flag.
Yeah. I think most of our experience is that on the 29th or the day after, we get a pile that is probably 95% of our applications. Some of them we're waiting dean's letters and a few board scores, but the bulk is there. And then a very small number that come in over the next 2 weeks. And there is probably some disadvantage to being in that small number that comes in later. But the bulk of them look to us like they all came on the same day. Whether you put them in on the 1st or the 15th of September really doesn't matter to us. Okay. Any other comments on that? No. So we're gonna have the second half of this session our wonderful residents in various stages of this training talk a little bit more about the process and how you evaluate programs. But I thought I'd take a minute before we wrap up and have each of the program directors talk to us about, why child neurology for you, or what do you love about this field? Just knowing we're also excited to see all of your applications and get you in our field to join us as colleagues. So I'm just going to go in the order that I see them. So Dr. Nelson, do you want to comment on that?
Sure. I didn't even know I planned to be a doctor. And so I decided late that I was interested in the brain and how people think and how you develop all of those processes you see more in children. But then once you work with children, I can't imagine wanting to work with adults. Like, children are just an extreme pleasure to work with. And then sort of why child neurology versus child psychiatry or developmental and behavioral pediatrics, I just love the mechanistics of it, the electrophysiology, these sort of emergent properties of things. And it's endlessly fascinating while getting to work with kids. So it's win-win.
Awesome, thank you. Dr. Holman Cooper.
Yeah, so I went into medical school knowing that I wanted to work with the pediatric population and really thought I would become a general pediatrician. I got a chance to get early exposure to outpatient general peds, and it just didn't capture my attention like I thought it would. And once I got to my second year of medical school, we did our mind, brain, and behavior course, and I just fell in love with learning neurology, learning the pathophysiology of it. And it just all kind of clicked for me third year when I got a chance to rotate in peds neurology. It was the pathology that I enjoyed seeing. There were things that were common, but things that I felt like I was only going to read about in textbooks. It seemed like it was a very emerging field. And we know now that there's so much more that we're able to do in terms of making diagnoses and treatment now than we could before. And so it's just growing, and I love it. It's something where I'm constantly learning and being challenged.
Thank you. And then Dr. Sheesh, same question.
Yeah, so I was going into medical school. I was leaning toward pediatrics. Neurology was like the second rotation I did. And what I really loved at that time was I was interested in metabolic disorders and inborn errors of metabolism and research and gene therapy. My career's kind of evolved since then. So, now what I've seen is kind of we deal with also families and quality of life, working with children. Some of them are disabled, not all of them, but some of them are, and just trying to counsel families and work with, and there's this wide variety, going from seizures to neuromuscular disorders to behavior issues. There's this kind of whole gamut. And I think, neurologists, we do such a great job. I don't know about your institutions, but our institutions, when no one knows what's going on, they go out and find a neurologist, and they send somebody to neurology. And then when they want a good summary of what's going on, they copy the neurologist's note. And so, that's kind of, what, the talent and expertise that we have. So that's what I love about it. Yeah.
Oh, awesome. Thank you. And Dr. Kessler.
I would echo what all of my colleagues here have said. I think that it's just a really special field. You can, it's a field where you'll literally never get bored. It's just not possible in child neurology. But it's not just about the subject matter. It's about the craft of explaining really hard things to families that are often really in distress at hearing these things. And that's pretty special too, and something that you'll work on and perfect, still very much working on it every day. And I think that combination of skills is pretty special. And for me though, the experience that made me want to be a child neurologist was that when I got to my neurology core rotation, and I had volunteered to do it at the Children's Hospital, I just felt like I found my people, that their sense of humor was like mine, that they thought all the nerdy things that I thought was amazing were also amazing. And so it was partly about finding other people who I wanted to think like and wanted to be like.
Oh, thank you. And I think that I'm not going to answer the question I asked. I'm just going to take a little spin on it, which is, just how excited I am for our field. How much from when I was a medical student till now, things are changing, from gene therapy and specific treatments for disease to the fact that you can craft your career to be an outpatient generalist or subspecialist or a neurocritical care doctor or a hospitalist, that we're starting to really in earnest enter into advocacy and global health and palliative care. And really, this is the coolest core information with this huge potential for this next generation. So I think I'll end the program director part by saying we aren't looking for one phenotype or one type of person. We're looking to build the future of this career and this field. And we're excited to have all of you apply. We're excited to read your applications. We will continue to answer some of the Q&A questions as we now turn this over to the residents for the second part of our session. I just want to thank our program directors, such a great group, and I think really excited to get to work with you guys. And if we need to do this again next year, we will, but we're going to get better and better at this. So I will, with that, allow the program directors to go off camera. And if you have time to go in and answer some of the Q&A questions, that's great. And then we will have the residents come on camera. As I say on interview days, you guys are the most important. You're the face of your hospitals and your clinics for the patients that call in, and you are the deciding factor for applicants. I think, you're how applicants know what a program is. You're going to answer questions this time, maybe less about your program and just more about your experience as residents and the field. Maybe what we can do is have you guys start by just introducing yourselves, where you went to med school, where you are, and what PGY year you are. So I'll call you just as I see you, and then we'll let you start answering questions. So we'll start with Dr. LeGrant.
Great. Hi, everyone. So happy to be here. So I'm Brian. I went to Weill Cornell in New York City for medical school. And now I am a PGY 1 here at CHOP.
Wonderful. Thank you. And then Dr. Subar.
Hi, everyone. My name is Gabrielle Subar. I went to medical school at the Technion American Medical School in Israel. And I did my pediatric training in South Florida and then transferred as a reserved position to Emory University.
That's great. And then Dr. Eichelberger.
Hi, everyone. I'm Hillary Eichelberger, originally from Texas, went to UT Houston, now known as McGovern Medical School. And now I'm a PGY5 resident at NYU in New York. And I did a combined pediatrics and child neurology residency.
Awesome. And then Dr. Sarnacki.
Hi, thanks for having me. Peter Sarnacki. I went to Michigan State University College of Osteopathic Medicine, and I'm a PGY2 at the Cleveland Clinic.
Thank you. And then Dr. Morel.
Hi, I'm Adriana Morel. I am a PGY4, originally from Houston, Texas, went to UT Houston also, and now I'm at UCSF.
Wonderful, thank you. Maybe we'll start with just comments that you guys have about the discussion that you've heard. Maybe we can go in the same order, just anything that you heard that you want to say something about. Dr. LeGrant.
Yeah, a lot of great discussion. One aspect that at least was stressful to me was the personal statement. And some advice I had for that was one, to start as early as possible. I think it can be a lot more stressful to try to do that within overnight or over the course of several days. So my approach to that, which some of you might find helpful, was to have a Word document with important interactions I've had with patients that I think could be potentially part of my personal statement. And even if not in my personal statement, having these stories that I could pull from was really helpful in preparation for interviews, so that I can bring them up for any kind of situation that I'm asked about. So I think starting that process early, and even as easy as just starting a Word document, thinking about these interactions you've had with patients that have been meaningful to you and have shaped your journey, is helpful and can pay dividends down the line when you're trying to make your personal statement more finalized, and then even down the line for interviews.
Awesome, thank you. And Dr. Subar, any comments about some of the questions that the PDs answered? Oh, we'll unmute, sorry.
You're right, and that will happen throughout the virtual interview process.
And we don't stress about it, right?
So just as an example of technical challenges. So during your rotations, especially the fourth year, get to know the residents, the fellows and the attendings on a more personal level, so they can write a more robust letter for you. And yeah, I echo Dr. Legrand's is start early and really reflect on all your experiences and all your passions and your entire journey that got you to this moment, that you can better present and tell your story.
And Dr. Eichelberger, any of the things that we talked about that you want to chime in on?
Yeah, I wanted to say just to everyone who's joined, if you've decided on child neurology or you're seriously considering it, congratulations, because I think that's the most important decision. I think, as a lot of people have said, child neurology is, of course, I'm biased, but I think it tends to draw the best kinds of people. And I truly think that whatever you pick within child neurology, your day-to-day job is going to be incredibly meaningful, fulfilling. We get to be the intermediaries with parents on the worst day of their life, or sometimes the scariest thing that's ever happened to their kid. And so it's a really good field. And so you've already done the hardest part. And then I wanted to say to just try to enjoy the interview process. You'll get to meet a lot of people who you will continue to see throughout the rest of your career, whether that's people you're interviewing with or the other applicants who you meet along the way. And so really try to not forget that, this is exciting and you're getting to meet a lot of people you'll work with and meet at conferences in the future, and enjoy that aspect.
Awesome, thank you. And Dr. Sarnacki, any comments from the first half?
Yeah, I'll just echo the sentiment that the personal statement really is your chance to show them who you are and not regurgitate what's already on your CV. They want to know about you personally rather than kind of all the various things that you've accomplished that they can see elsewhere. I also resonate with the idea of how do I prove to a program that I'm very interested in this place I've never lived before. And I would say just go about that honestly and say, I've never lived here. I might not have been to this city before, but I'm very interested in the program, and just try to go about it in a very honest and open way.
Awesome, thank you. Dr. Morrell.
I will also echo many things, but I just start early with everything, with the personal statement, with your applications, with getting letters. I was going to do adult neurology and then last minute switched to child neuro. So it was a lot of kind of running around, having that extra stress. So in that situation, I couldn't have done anything, but just to try to start early as possible. And with the idea of also being from a different place and coming to a city that you've never been to. I'm from Texas. I've lived in the South all my life and I wanted to go to San Francisco, but I told them I was very open and saying, why are my reasons? What do I want to go here? And I felt like there was a skew, as in Texas, people always stay in Texas or go back to Texas, but not the case. So let them know.
Yeah, that rule is broken now. So one of the questions is, maybe you can answer it this way. So the question is, how many programs would you suggest applying to? Maybe if you guys remember how many you applied to and how many you interviewed at. Anyone want to answer that? It was a while ago for some of you, but.
I can answer from being one of the people who interviewed virtually. I think on average, like speaking to my classmates, most people apply to an average on like a couple more programs than usual. In pediatrics and child neurology, which are both very similar in terms of like applicants and applicant numbers and interview numbers. I think like most people tend to apply anywhere from like 15 programs to 25 programs. And that can vary like depending on how widespread you want to go, depending on your application and whether you have aspects of your application that you think might help you or hurt you. And that's something that I think can be individualized depending on your situation with your mentor. But most people I had talked to applied between like 15 and 25 programs, and aim to interview between maybe like 10 to 15 programs. So a lot of people use like the matching outcomes document to see how many they should aim for. And most of that data shows around after like 9 or 10 interviews, your chances are very high. And so I think that's what I had gone from my experience and then from other people's experience.
Yeah, and I don't think those numbers changed a whole lot last year with the virtual interviews, and the AN document for this year that was the consensus statement about doing virtual said that there was not a single child neurology applicant who went unmatched if they ranked 14 programs. So I think those numbers, it'll be individual for everybody, but those numbers are about where we're at. I would love to hear from you guys who did both in-person and virtual interviews. How did you sort of decide on your rank list? Like how do you assess a program to figure out if it's really, the right one for you?
Yeah, I can start answering that one. So I think that's very personal. It's on a very personal level. For some people, it's location. For some people, there's a specific tract, or the program is strong in a specific specialty, or they have a fellowship you would eventually want. As someone that personally went through the virtual interviewing process last year, I do remember feeling like every program I got this similar impression, every program felt the same. And I really had to dig deeper to really differentiate each program and get a better feel for it. And just some tips is really getting, really engaging with your interviewer, not so much focusing on, watching yourself in the camera, but really making eye contact with your interviewer and speaking with the residents that you may meet on the meet and greet the night before or the day of, speaking with them post-interview and over the phone or on a video conference, just one-on-one, and really getting to know the program on a deeper level and to look for consistency in what people are saying.
Thank you. Anybody else want to add to that?
I'll add that when I was looking at programs, being from someone who wanted to do adult neurology and also now wants to do child neuro, I try to look at programs that have a really good relationship with their adult neurology like colleagues, whether they're in the program of like adult neurology, or you just spend we all spend a lot of time with adult neurology, but just kind of that relationship between the two programs is one of the things I look for. And of course, like city and then population that you'll be treating was a big thing for me. I wanted like a big diverse city with diverse populations and people all over the world. So that's what I looked for.
Wonderful. Any other comments about that? Otherwise, my next question for you guys is, how did you prepare for a given interview day? Or are there things you wish you had looked up or known in preparation for an interview day? I'll let anyone who wants take that one.
So I think anyone would advise to make sure that you've looked at the program website, if there is one, and make sure that you know kind of the easily accessible information that's out there, because it's not a good look if you're asking about something and it's very much easily displayed, and it makes you come off as not really interested in the program. And so I would definitely familiarize yourself with the program's website, the information that's available there. If you know in advance the people that you'll be interviewing with, it can be good to look up those people, know a little bit about what their particular clinical or research interests are, so that if you have overlapping interests or something that they've done research and piques your interest, then you can bring that up during your interview. And it just shows that you are really genuinely interested and that you've done your homework beforehand. You don't have to go memorize anyone's CV or anything, but just make some effort to know about the program and know about the people.
Wonderful. Are there any interview questions you guys wish you knew you were going to be asked, or wish you had prepared for or practiced an answer to?
Yes, I'm not a fan of practicing interview questions, but you always want to be able to convey why this is the field for you. You have to have, a way to convey that, to show that you've really thought it through. The other things would be like the things that are on your CV. You want to be able to explain those in a way that you really understood them and they found meaningful for you. And yeah, I mean, besides that, I wouldn't say certain questions per se.
Anybody else? Were there questions you wish you'd thought through, or that people should be prepared with an answer for?
I think the ones that I think it's impossible to prepare for every single question you will be asked, but I think the ones that could have been harder and were harder for me were ones that were tell me about a time when this happened, because sometimes it's a very specific experience or situation that might not always be easily rememberable by you. So that goes back to what I said earlier about having a bunch of different patient experiences and stories that you can draw from. I think if you have a bank of those in your head that you remember and remember well, because you've really thought about them, you can really adapt those stories to answer a lot of those kinds of behavioral questions. So yeah, that's the advice I have for that.
And I know practicing an interview isn't for everyone, but I found it helpful just to have, a friend or a family member start practicing asking you questions, so that you can it's kind of a skill that you cultivate, coming up with an answer in the moment. And so I don't think that it hurts to practice just a little bit, thinking on your feet, having those stories ready, being able to kind of reshape any clinical experience to answer a different type of question. I think it can only help to just practice doing that a little bit at least.
And I think it's common for there to be, and I think Dr. LeGrant had sort of referred to it, questions that try to get at who you are as a person. So it might be, think about a time that you had a difficult clinical interaction, and how did you handle it, or what did you learn from it? That's a common question that, some people like to have thought through that a little bit before. Then some people will come to the interviews with a specific series of memorable patient interactions that maybe help them with their desire to go into pediatric neurology. And those are good things to at least have, thought through in your head. I think everyone's worried about where do you see your career? How do you want your career to be? But please know that we don't hold anybody to it. And, most residents aren't doing exactly what they said they were going to do anyways. But sometimes there's a little bit of a fit question. This is maybe a research heavy kind of place. And if you desire something else from your training, maybe you'll realize it doesn't fit. So those are the kind of questions. Anybody have other off the wall questions that you were asked, or things to know about the virtual interview question and answer stuff? Anyone have
One-
their
One question I enjoyed was, what do you think is going to be most difficult about intern year? And that helped, help myself reflect on strengths and weaknesses and what to anticipate. And I just thought that was a good question. And, if that's something you're going over, that would be a good question as well.
Mm-hmm. Yeah, that's a great one. A little bit of insight where you want to be able to talk about what you learned, or about yourself, and what drives you. That's a great question.
Another difficult question, that I was just asked recently during fellowship interviews is, tell me about a time where you made a mistake and how did you handle it? And that's something that, is kind of a difficult one to think of on the spot if you haven't, if you don't remember anything.
Yeah, that's a good one to prepare. Perfect. Good. And then let's see, there are some questions coming in through the chat. What are specific questions you should be asking programs during your interviews? And is it frowned upon to ask about details like call schedule? Anyone want to comment on that? I don't think it's frowned upon, but
I think some questions are more appropriate for the residents, and when you're discussing the program with the residents versus the program directors or other attendings that are interviewing. I think it is appropriate to ask about the call schedule just so you know what you're going into, and it is a big factor of your lifestyle and your schedule. And just any question. I think that's respectful and curious is fair and okay to ask. I can't think of anything that's unfair.
I do think it's important to know your audience. So certain questions are definitely more appropriate for your interviewer. If there's a scheduled interview with residents, then the interview with the program director or faculty. And so just kind of use common sense to tailor what makes the most sense to ask one person or another.
Great. I wanted to spend a little bit of time talking about post-interview communication. So we're very specific and clear that programs do not require, and they will tell you they don't require a thank you note to, consider you or, understand whether you're interested or not. And certainly do not ask applicants where they're going to rank that particular program. But from your experiences as prior applicants, were there aspects of post interview communication with the program or the residents that was helpful to you? Or how did you go about thinking about how you communicated with programs you were interested in?
Yeah, I think it's a match and it's not a one-way street. I think abiding by ACGME regulations, you should reach out to people and programs that you're interested in. And after reflecting on after your interviews and reflecting on all the programs you've reviewed, I think ask follow-up questions and get in touch with the residents. Again, virtually, it's hard to get a good sense of the program through a two-dimensional screen, but there are ways and some legwork that you can do post-interviews to get a better sense.
Yeah, and it's not just about letting a program know you're interested. It's also to help you get a better sense. I think one advantage that the program directors find to the virtual process is that if we learn on interview day, you're really interested in a particular clinical topic or research topic, we can help, facilitate a brief Zoom or phone call with someone on our faculty or a resident doing a similar project. So I think asking for those things to help you in your decision making is absolutely appropriate. And looks like there's a question about sort of the general peds experience and then transitioning to the adult neurology world, and how did that go? How do you prepare for that? It's a hard one. Do you want me to call in somebody, or somebody want to answer that one?
I'll say something since I've just made the transition back to children. It's very hard. It's 3 steps in your training. First, you're like, I'm a pediatrician. I do neurology whenever I have to, but I'm a general pediatrician. I'm learning general medicine for pediatrics, and that's it. And then you push yourself into the adult program, and they teach you some stuff beforehand, but then you also are now taking care of, like, you're learning neurology, but you also have to deal with learning internal medicine, which I haven't done since med school. So you feel dumber than everyone in your program, all the other R2s or the other neurology residents, because you haven't done a whole intern year. And then you finish that and you have, some knowledge under your belt, and then you go back to children and go back to applying the neurology that you've learned to pediatrics. So it's just like a whirlwind. You're jumping from like different specialties, but it's fun. I thought it was fun. So it's difficult, but you learn so much.
Yeah, and I think that's something it's important to ask about during your interviews is, what does the program do to help you with the transition? Is there any sort of like training between the two different fields? And is there like a buddy system, or what kind of support is there? Because it is a big transition for us, but everyone gets through it. And there are certain things that that typically are done to help with that transition.
And any other comments, Dr. Sarnecki? You're in it as well, right?
No, I'm looking for all these tips. I'm PGY too, so soaking it in.
Okay, so you're in peds. All right, so we have a nice mix.
Yes.
Yeah, it's in the long run in this field, probably in the next decade, the amount of time in adult neurology may be shortened, but for a lot of programs, there are transitional preparations, and there's a customized adult neurology experience to get you the stuff that you need to move forward to child neurology. But it's part of why I think we're such a special group of people, because we just, roll our sleeves up and learn what we need to learn and do what's in front of us, all in, honor of being able to take the best care of kids with neurologic conditions in the end. And for the most part, in most programs, you're in it with other people too, which is nice. Good. Are there specific questions that you should or wish you had asked programs when you were interviewing? It sounds like there are none that you wish you hadn't asked. It sounds like you can ask detailed questions.
One question I thought was really helpful is asking what were the biggest change for the program in the past year or two, and then what do you expect the biggest changes are coming up? Because a lot of the times they would mention things I didn't know, like actually we're bringing a new subspecialist that wasn't mentioned before, or actually our program just went through XYZ that I didn't know about. So I thought that question was very helpful.
I think that it's important to ask residents, like, what are your favorite things about the program and what are the weaknesses of the program? Because the residents are the closest to you, and they're able to give you honest answers to those questions for the most part. And I think that their perspective is really useful. And throughout my interviews, I think they were the most kind of valuable people, really giving me insight to what it's like to be at that program. And so I would not shy away from just milking all you can from residents during your interview.
One thing I didn't ask initially early on in the interview season, but found really helpful later on, I started asking, was to ask like faculty members who have been there for a long time, like what's kept them at that institution? Why are they staying there if they have a choice to go elsewhere? And I think that question is really valuable because it gives you a sense of the culture of the institution that you might not get from like a resident who's been there a year or two. And I thought that was really nice to see, like, especially like if they have been there a long time, why have they been there a long time? And you can kind of see a trend like, oh, people really like to be at this place and tend to stay. So I think it gives you like a deeper insight that you might not get from a younger resident.
That's helpful. Dr. Subar, do you have more to add?
Yes, I'll just add asking residents if they are exposed and if they manage, the bread and butter in child neurology, and as well as the zebras, because I found that in some large referral centers or tertiary care centers, they were seeing more of the zebras than they were bread and butters. And at the end of the day, it is a general, pediatric neurology training, and I think that's important for whatever you choose to do in your career. Is that seeing a spectrum of things.
Adriana, any other comments on those questions that you should ask?
I don't remember any of the questions I asked. It's been such a long time, but I did ask, I try to know what each interviewer was about and ask them specific questions to their thing, to their topics. But sometimes I learned that some questions like, oh, in general, what has changed about medicine? If you talk to older physicians, like older, they'll just complain about EMR. So that's a question I like to avoid, because I had it 3 times with different institutions, like the elderly people complain about EMR. But so avoid that if they're over the age of 60.
Oh, I'm so relieved right now that I'm not fitting in that. And I promise not to complain. That's good. There's a question here about sort of talking about maybe your personal inspiration for pediatric neurology. If maybe there's an experience in your family, or talking about your actual local family that you live with. Is that something that you think should be included in your either personal statement or application in some way, or during your interview day?
I will say that if it's something that you want to include and it means something to you and it means something to you becoming a neurologist, I think that's important because that's part of your journey. I included a lot of personal things that have put me to this journey, like very personal details that I think are helpful in understanding why I chose neurology. So I think if that's really important for why you're choosing neurology or what makes you want to do it, I think it's fine if you feel comfortable saying it. You don't have to, but if you feel comfortable sharing, I think that's okay.
Yeah, I think the goal of your interview day is really to just show what you're passionate about child neurology, what makes you uniquely interested in child neurology, and whatever that is, whether it's your patient experience, your family experience, your research, whatever you're most passionate about and what you can and what you enjoy, talk about that, because that will come across. And so I really think that you can speak about anything, even if it's a personal experience, if it's shaped your path to child neurology?
Thank you. This is an important question. Do you have any recommendations about asking programs about how they're working towards being more anti-racist or, dealing with microaggressions? Were you able to ask those questions, or how would you think about going about asking that to a program? Without coming off as aggressive is part of the question, which maybe is an important caveat to that.
Oh, go ahead.
I'm sorry, go ahead. Okay.
Dr. Subar will let you go. Yeah.
Okay, thank you. So I think, these being hot topics, especially in contemporary times, I think it's a fair question, and it's all about whether, it's all about your intention. If you intend it to be an aggressive question, I think it will come off like that. But if you intend it to be a question of interest and finding out if there's an opportunity for you to become involved, whether it's in a committee or bias training or, those types of things, then I think it's a very important question, because if it's important enough for you to think about it, it's important enough for them to know what's meaningful to you.
Thank you. And Dr. LeGrant, do you want to add your comment?
Yeah, I definitely agree with that. And having interviewed in the last year, as Dr. Subar was mentioning, there's been so much happening in the last year or two on that front that I think programs did a great job of really focusing and emphasizing the ways that they're improving on their diversity and anti-racism. And so I felt like it was very comfortable for me and other applicants to ask about those, because the program directors or residents were almost inviting those questions because they brought it up to show how important it was at their institution. But otherwise, yeah, I agree with Dr. Subar, expressing your interest in it and asking how you can potentially contribute to those in that institution would be a great way to ask the question.
Thank you. Any of the other residents have additional comments for that? Yeah, there won't be a program that doesn't say something about it. Every program is talking about it, but I think a deeper dive discussion about what's really happening or how residents are or could be involved is an important question, and I think would be quite respected. This always goes by so fast. I thought I might have us wrap up by asking each of you to answer the same question. So the question is, what's your favorite part about being a child neurology resident? And I'll start in the order that I can see you. So Dr. LeGrant, you're top on my screen there. What's your favorite part about being a child neurology resident?
It's a little difficult having just started, but what I really like about child neurology was that you're not just a child neurologist either. You're taking aspects from adult neurology where you're learning a lot of the pathology. You're taking aspects of general pediatrics because you're getting the full training in general pediatrics, like a normal categorical pediatrics resident would. So I like that you're kind of an expert in multiple realms. You're not just the child neurologist, but you're also the pediatrician. You know the general pediatrics knowledge. So I like that you really have to take an interdisciplinary approach to it and use all these different areas of expertise that you've gathered over the years.
That's awesome. Thank you. Dr. Subar, what's your answer to this? What's your favorite part so far about being a pediatric neurology resident? Oh.
The families and the children. And yes, treating, children with neurological diseases. But yeah, the children win me over.
Every time. Yeah. Wonderful. Thank you. Dr. Eichelberger, what's your favorite part?
My favorite part is being able to, come into a situation that's often like really terrifying for parents, really overwhelming, or just really hard to experience, and being able to help make that better for them, or just kind of help kind of bear that with them. I think that's really unique about child neurology, and it makes our everyday work really worthwhile.
Thank you. Yeah. And Dr. Sarnacki.
Yeah, I just find it immensely fulfilling that, the neuroscience that we love reading about for so long and then finally getting able to apply it, is really just a dream come true to be able to help a kid in any way that, whether they're sick or vulnerable, is immensely satisfying for anyone. But to be able to use the thing that we find so intellectually stimulating, the neurology, and to see it and have a positive result helping a child is just, it's a dream come true every single time. It's awesome.
It's pretty super cool. I agree. And Dr. Morrell, what's your favorite part?
I would say right now, after my year hiatus with adults, is children. Just being able to play with children, being able to take that neurological exam, play with a child, and be able to be like, I know what's wrong, or I have no clue what's wrong. So it's just the patient population for me at this moment is just really fulfilling. Beyond children, their families, and the treatment team is great.
Oh, that's wonderful. Thank you. Well, we have just a couple more minutes. I think all of the questions in the Q&A have been answered. And you guys were really great with addressing them. Any other comments any of you guys want to make before we close?
I would just make one more comment to add to the question of transitioning from peds to adult neuro, is that the adult neurology residents also rotate through pediatrics, and they feel just as lost. So that was reassuring, and they understand that, you're, a pediatrician and not an adult provider. So don't fret, it'll be okay.
Yeah, you take care of each other, right? They help take care of you, and then you help take care of them when they do their required child neurology. But I honestly don't know who's more scared, you guys or them. I think them, honestly. Babies can be scary if you don't know how wonderful they are. So good. Any other closing comments from anybody?
Don't forget to enjoy your 4th year if you're applying this year. You have lots of years of residency ahead of you, so take advantage of your free time.
That is super important. Yeah, we should all have very fond memories of our 4th year of med school, for sure. Good. Well, we are just about to wrap up. Anybody else have a comment?
The last thing I was going to say was to, again, enjoy the process and enjoy the interview process. Child neurology, as I've learned, is a very small field, and everybody knows each other. And for all of you who will be applying and interviewing this year, this is your entry into the field, and this is the way you're going to start to get to know everybody across the country. So look forward to it and making those connections.
Yeah, absolutely. Welcome to the field, right? We're, as I said, we're excited to see your applications. We're excited to tell you about our programs, and definitely, this will be recorded. There'll be the opportunity to ask other questions. And I'm going to just let any of the PDs who've maybe been answering some of these Q&As, if they want to add any last minute thoughts. Dr. Nelson, did you want to add a thought?
Sure, because people have talked about enjoying the process, which I think is important. I just emphasize, be genuine through the process. It serves no one's interests, whether we be programs and program directors or you for the next 3 to 5 years of your life, if you don't represent who you are. And so you really want to find the best fit for that both ways, based on your interests, your personality type, what will make you happy and thrive, because that's what people want.
there's a place for all different kinds. The numbers are good in child neurology in terms of open slots versus applicants. So there is a place for you. Make sure you represent yourself well to find that place. Any other comments from the other PDs? Dr. Kessler?
I was just going to agree with Dr. Nelson completely. As hard as it feels like it is sometimes to be yourself on screen, try to be yourself, because it will serve you well in the end. And also just trust your gut. It's your parietal lobe telling you something. And so just know that those feelings that you get from your discussions with residents or even other applicants that you're in contact with, I mean, recognize that there's a lot of extraneous hearsay and stuff too, but trust yourself when making these decisions.
Yeah, absolutely. Any other comments?
I was just going to add, in terms of when you are thinking about which programs you're going to rank highly, making sure you know yourself and what type of environments you thrive in. Residency is going to be challenging no matter where you are. And so you want to make sure you have a place where you feel like these people are going to be there to support you, it's particularly if you're away from your family. And also just thinking about, is it very important for you to be close to your family to have that support system? So really considering what things you need to thrive in a program, what things you need for your personal wellness.
Super important. Dr. Sheesh, any other comments?
Yeah, sure. When we're looking at applicants and we've kind of invited them for interviews, I think one of the things I always tell applicants is you have to relax, and a little bit kind of like what you guys have said. I think there's more pressure on us as program directors to kind of try to attract applicants to our program than there is for the applicants to kind of impress us. I mean, the people that we interviewed, we already know that they're academically good, and so yeah, we just. I think I tell kind of our interviewees to kind of relax and have fun, and we want to see is people who are interesting, are going to fit in the program, that the other residents are going to like working with, that other people are like working with. And so yeah, that's I think the really big thing is kind of just personality and having fun and having some kind of interest. It doesn't have to be kind of this super kind of competitive academic thing. That was like college, and now it's more like kind of interesting, fun people that are going to work together, and and we want to have kind of fun people, because the hospital medicine can be stressful, so we want people that are going to be kind of fun to work with and pleasant to be around.
100% agree. And with that, I think we are done. Thank you, everybody. This was wonderful. Thank you for your time, for all the program directors and residents. Thank you for all of our future applicants and interested who came on and asked questions. And thanks to the AAN for organizing this. There will be a recording available in the near future too. With that, I think we'll say good night. Thanks.
Great, thank you.
Everybody.